always have cold hands and feet, that might be a sign that maybe they're deficient in.
Very good sign. Yeah, very good sign.
Yeah.
Their circulation is just not making it there quite as far.
That's interesting. And what about B12? I read a study recently that something like 75% of people in nursing homes are deficient in B12, which they feel is causing dementia.
Can cause dementia, and it may even be linked with some forms or some amount of anxiety as well, because B12 is primary, part of the rate limiting step in terms of getting into able to use oxygen as your energy source, able to be aerobic in terms of your energy. If you're always running what we call anaerobically, that can be very taxing on the system. So you end up with a little shorter breath, a little bit faster heart rate, faster breathing rate as well. And when you can't breathe well, that's very anxiety promoting. And if you don't believe that, put a plastic bag over your head for a minute. And it's very anxiety producing.
It does, for sure. Yeah, and actually I just did a great class yesterday on all on pranayama, the breath, and everybody who came out said, like, I felt like I just went on a week's holiday. It was so relaxing. I felt so good. I felt so energized after. And so that's all about the breath. So we need, and of course, you know, the breath is immunity. You know, it helps our immune system as well. So that's fascinating. Last question is about, in regards to nutrition, is magnesium, because everybody I see seems to be deficient in magnesium. So is that something you...
Again, it burns up very fast in that high stress, that fight or flight type response.
So we use more magnesium.
We use much more, much more. And the important part with magnesium is that it's part of, when our muscles contract, we use calcium that helps the electricity form the contraction, but we need a flood of magnesium to make the muscle relax. So when you're dealing with somebody who's got cramping, spasming, or just that like always tight, and you know from what you do, there are people that just are chronically very tight, very sore all the time.
Right.
And that's usually partly at least a magnesium thing going on as well. Going back to your previous question, we talked about like aerobic, anaerobic, and we talked about some of the things. And you said when people just slow down a bit and breathe, they feel so much better because now they're getting the oxygen, they're able to go aerobic. When you're anaerobic, the other thing that it drives, because you're not using the oxygen, is it starts to drive you wanting to eat more sugar to fuel it.
Interesting.
So you get into that spiral as well.
Wow.
So you may find people are doing like that deep breathing and even just slowing down, doing a little bit less. And they're able to do a little more because they're doing it a little more aerobically, and they're not going to be driven into that sugar want, that sugar desire.
Well, that's interesting too, because that's a huge problem in our society now, is sugar addiction. Last question, I guess, is about, do you deal with seizures? Because that's also something I've seen a lot in my practice.
It seems like we're seeing more of that, for sure. Yes. Do we deal with seizures? Seizures, absolutely. I like to see all the reports first. Sometimes that's an issue, getting all the reports from all the various specialties involved. And sometimes working with people who are on some of the medications, because that can be difficult as well. But yes, we still deal with seizures as well. And again, similar kind of thing. It's a matter of sometimes figuring out what filters are not working well, just to take a little burden off the brain. We're not changing medications and doing that sort of thing. We're just looking at how can we just make things a little bit easier on your overall processing of just your day-to-day things. And if we do that, you may have a little bit less misfire.
And that brings up a great point, that a lot of people feel that they can't, again, do holistic things as well as medical things. That if they come to see us, we're going to take them off all their medication and your doctor's going to get mad and all hell's going to break loose. So how do you convince people that you're seeing that it's okay to do holistic treatments as well as medical? I mean, yeah.
That's kind of a funny question to answer, because I would say I'm not really trying to convince anybody anymore. I just kind of lay out the plan. Here's what we can do. Here's how we do it. Here's why we're going to do what we're doing. And in regard to like their medications, their doctors, etc. If their doctors have questions, my door is always open for them to give me a call and talk. so far nobody's ever called.
Yeah.
It's kind of funny.
Well, it's true with nutrition as well, because, you know, I will ask people to, you know, go and like get blood work done through their doctor, and if the doctor wants to call me and so I can explain why, and they never call.
Yeah, never any calls.
Yeah.
But exactly, we're not taking people off of medications and doing something dramatically different and opposite. We're looking at, okay, well, here's where you're kind of going in the direction. Well, here's how we can support it best. And if there looks to be a conflict, then we're going to talk about that, because sometimes there is. You know, especially when I came across just this past week, and it comes up often. Someone with let's call it dizziness, vertigo, whatever you want to call it, a loss of balance, and very episodic, but they're also on blood pressure medication.
Right.
That's a tricky combination. So, you know, I usually try to do what I can do in terms of that rehab, but there's usually a point where we have to sit down and talk. It's time to talk to your doctor about looking at blood pressure medication again, because it may need a little tweak. You know, not to take you off, and certainly don't stop on your
Yeah, especially.
But sometimes just that little tweak, because if your brain starts to get better, but you've been medicated to pull it way down, then as your brain's getting just normally better, along with medication, it's a little too much, and now some of that dizziness is from the medication bringing blood pressure a little bit too low. So, and most of the time, the doctors are quite happy with that. You know, I haven't had anybody call me angry about that. But again, nobody's ever called.
Yeah, exactly. Well, generally what happens...
But when patients come back, they usually say, yeah, I talked to my doctor, and you know, we said, take it down a little bit, and then we go from there. So that's been good.
Yeah,
so
we want to work with the medical community, and we want to make sure that everybody stays safe. So
yeah, and no matter what medical system you're in, whether it's our local one or wherever you are around North America or even the world, you know, we're really looking at, everybody's talking about this team aspect, but it seems like this team aspect really just means, well, we've got this, and this in the office, but nobody talks to each other still.
Yes, right.
Which isn't really so much team, it's just, you know, we're giving kind of lip service as to, you know, we've got all these different things, but nobody knows how to work together yet.
Yeah.
Which is definitely unfortunate.
Which I think is a great benefit from our clients, is they can see you, and then they can see me for nutrition, and they can come to yoga class, and they can, you know, they can benefit.
Yeah.
You know, in many different ways. So lastly, anything else you want people to know about what you do and why they should come and see you, or?
I think we've hit the high points. You know, we've got balance issues, especially balance issues, kids with, you know, reading or even learning type disabilities, especially if they've gone through the different specialists. You've gone through like these different drug therapies. Often with some of the dizziness things, people have gone through like a series of what they call the Epley maneuver, because they're told, oh, all your dizziness is because there's a crystal in one ear. And sometimes that works, and often it doesn't. But that's where we kind of go from there. You know, it's interesting. I'm usually way down the list for people to see. You know, they've usually gone through, you know, several specialists, if not, you know, 6 or 7 specialists before they get to me.
Yes. Well, I find the same thing, because I'm not covered by anybody's health plan, both for Thai massage and nutrition, and so I find that people have exhausted the other avenues, and then, but it's through us that they actually get the help.
And a credit to them, they're still looking. They know they can be better, but they're just not sure how yet.
Yeah, and that's the greatest type of client, the one that wants to be well, that wants to search out new techniques as well. Thank you very much for visiting.
Thanks for having me,
Brian. You're welcome. And yeah, we'll see you next time on our podcast.